Hi, this is Dr. Brian Castline with Brighton Foot and Ankle, and today I'm here with Kevin. Kevin helps me with correct bunions. He's in the OR. He's making sure that everything is set up, good to go, so that way we can get really good corrections. So, Kevin, how long have you been in this surgical industry and with bunions?
In the industry for about 18 years, specifically with bunions, a little over 10 years.
Awesome. How many surgeries have you been in?
Thousands.
Thousands? Yeah. Probably almost over hundreds in each year too, I'm sure.
Well, just with you alone, I've been close to 100.
Yeah, we've done quite a few together. So, what's some of the coolest things that you see in the operating room now?
Oh, I would say probably the coolest thing I get to see in the OR. I get a front row seat to watch you do your magic, right? I see people come in with these crazy deformities, and they walk out with anatomically correct feet.
Yeah, cool. Yeah, usually it takes us, I don't know, an hour or two with what we're doing with this stuff, but it goes pretty quick. So, throughout your years, I'm sure you've seen some things kind of come and go out of the operating room. Well, what are some of the current trends that you're seeing, and what are some things that your company is doing to help correct bunions at a better rate, faster, quicker recovery, those things?
Well, I think you just hit on it. I think the biggest thing is the industry is they're moving toward more minimally invasive surgeries, right? So less scarring, less damage to the soft tissue, which means quicker recovery. We have a number of different systems, as you know. There's over 120 different ways to actually address bunion correction. We focus on two.
And what are those ones?
Traditionally, I mean, we do. We have a take on the Lapidus procedure, and we also have a jig and reproducible MIS approach as well.
Nice, awesome. So again, you said the bad number. What was that historically? How many bunions can come back?
So with a lot of the previous procedures, a lot of the older procedures that have been done, purely cosmetic, and with those, typically you see about a 72% recurrence rate.
Yeah, and with yours, you said you're closer to 100.
Yeah,
it was.
Yeah, we're 98%.
Yeah, and so
with this procedure, 98% of patients will not see recurrence.
Right, which is awesome. But people still might hear the horror stories of bunions. They might hear that 70% that comes back. What are some other things that your company that we can do in the operating room to help get rid of some of those stipulations and some of the negatives that people hear about bunion surgery?
Of course. So reproducibility is one. Minimal invasion to the joint. We find that early weight bearing with our product, your patients can weight bear possibly the same day.
Yeah.
So one of the biggest reservations with bunion surgery is the length of time it takes to heal. Some people have to go back to work. Again, recurrence, right? The thought that they may have to eventually go back and get another surgery down the road. But with the system, immediate weight bearing.
Gets them feeling better, much quicker.
Yeah.
Which is great too. Again, we like to use some of the classic tips, some of the classic procedures that have been around for decades. Kevin's companies help us make those results way more reproducible, way less complication rate, and get people feeling better quicker.
100%.
So, yeah.
100%.
Anything else?
I think one of the biggest misconceptions with a bunion is that there's a deformed bone, right? And as you know, it's not a deformed bone; it's a straight bone. There's an issue elsewhere in the foot that causes that bone to drift.
And so it's great, and what he's referring to is a lot of joint work. So we do a lot of joint work to make sure that we correct where that bone's being angled and make sure it goes away. So thanks again, Kevin.
Thank you.
Yeah,
Appreciate you.
Yep, thanks.